Hi, my name is Alejandra and today I will talk about oral hygiene. First, I have to talk about toothbrush. Toothbrush can be divided by its size, texture, and bristle forms. In size we have large, medium, and small. And in texture we have hard, medium, soft, and extra soft. In bristle forms we have rounded, diamond-shaped, and standard round bristles. Nylon versus natural bristles. Nylon is 10 times more flexible. They don't degrade or erode, and they can get cleaner more easily. They are more easy to use and also cheaper. And they are more effective in interproximal spaces. Natural bristles can vary in diameter and in each filament. The firmness or texture of a soap relates to its composition, if it's nylon or PET, its diameter, and its length, that can vary to 10 to 12 millimeters. We recommend replacing toothbrushes every 3 to 4 months. During the use, the brush becomes more smooth and rounded. With continued use, the bristles expand and also disperse. The wear of bristles vary directly with the load and amount of brushing and traffic. Electric toothbrushes. In 1986, they were first announced nationwide in the US. They were recommended primarily for people with disabilities. And published studies have shown that these brushes are more effective compared to normal brushes. We have different types. The rotatory one, who has reciprocal movements and arcing movements, and the sonic vibrational rotation, who have forward and backward movements. In toothbrushing techniques, we have plenty of them, but today I will talk about 4 of them, the most important in dentistry. The phone technique. The phone technique, it is a technique recommended in younger children given the lesser skill at performing toothbrushing. It consists of making larger circular motions with the child mouth closed, stretching from the edge of the gum less than the tooth. And it is achieved by removal of the plaque and simultaneously massaging the gums, like in this video. In the biting area, in the same phone technique, you make circular movements, like in this animation. The Leonard technique, it consists of movements up and down with the child mouth closed, stretching from the edge of the tooth about to the gum bottom. It is achieved by removal of the plaque and simultaneously massaging the gums. The second technique is different to the other techniques because the brush has to be placed at an angle of 45, covering part of the tooth and the gum. It is used as a vibratory movement with a pressure to stimulate the gum. The brush is then lifted and placed on the same hand and repeats the pulse movement. This is a video showing how the second technique is performed. In the biting area, you make circular movements like in the phone technique. And the pass technique. We place the brush at an angle of 45, performing anterior-posterior vibratory movements, but without moving the brush from its fulcrum. We make very short movements from the bristles to flex about its own axis, but we cannot move the ends of the support points. This technique is very recommended for adults with periodontitis or gingivitis. The pass technique is in the chewing area. We make a quick stroke movements to remove all traces of food. It is different like the phone technique that in the chewing area we make circular movements. In this we make a quick stroke. And which is the frequency of toothbrushing? For too long, the dentists have instructed his patients to brush their teeth after every meal. The ADA has modified this position and stated that patients should brush with regularity. Full brushing requires a different amount of time for each person and is depend on his innate tendency to plague it up, his psychomotor skills, and the adequacy of food recall bacteria and differs by saliva. And we recommend also to make 5 to 10 movements in each region. The bad smell of the mouth comes from the tongue most of the time. To brush the tongue, we have to make a card forward with a sweeping motion, and it had to be repeated 6 to 8 times in each area. Also, if we want to have a good oral hygiene, we have to floss once a day. And my conclusion is that oral hygiene is a very important, and a simple decay can clog an artery, which affects circulation sufficient to cause bacterial endocarditis and a heart attack. Thank you.